Hello, this is a video from the McGugan Library of Medicine, Research and Inquiry, Evidence-Based Medicine Basics. This is the first of 3 modules about this topic, and the first one should take approximately 10 minutes. Additional readings will be referenced as well. Part 1 will be a video to introduce you to the concepts of evidence-based medicine. Part 2 will show the step of a search strategy. And Part 3, another video, you'll see how to appraise the information you have found. Evidence-based medicine is the conscientious use of current best evidence in making decisions about patient care. It's a change from health practitioners making decisions solely based on personal experience. The steps of practicing EBM are ask a focused question, find the best available evidence, critically appraise the evidence, and then apply the evidence in practice. In this series of 3 tutorials, we will define evidence-based medicine. We will formulate a searchable question using the components of PICO, PICOTT, construct a search for randomized controlled trials, RCTs, appraise evidence for effectiveness as related to patient. For each objective, we will have you complete an activity and then evaluate your learning with a small assessment afterwards. Let's proceed to part 1 of the 3 tutorials, the introduction. First of all, you may ask why this is becoming so important. One of the issues is that the rate of publishing has increased, making it impossible for clinicians to keep up. At an average rate of 75 clinical trials and 11 systematic reviews being published daily, it is simply too much. Therefore, it becomes necessary for us to be more selective when searching for medical literature. To begin, we're going to take a look at the evidence pyramid. You may see an evidence pyramid with more levels, but today we'll address 4 levels of evidence. These are grouped into 3 different types of resources that you'll see on the right: filtered, unfiltered, and background resources. Now for a little more explanation on those. In filtered resources, clinical experts and subject specialists pose a question and then synthesize evidence to state conclusions based on the available research. These filtered resources are helpful because the literature has been searched and results evaluated to provide an answer to a clinical question. With unfiltered resources, it is up to you to assess the quality, validity, and applicability to your patient. Because these are unfiltered, this will take a little more time and expertise. Background resources are just what they indicate. They are there to provide you with an overview of a disease, condition, or concept. Textbooks are one of your best sources of background resources. That covers the 3 types of resources: filtered, unfiltered, and background resources. Now let's delve into the 4 levels we've shown you on the evidence pyramid, starting at the top. Systematic reviews focus on a clinical topic and answer a specific question. An extensive literature search is conducted to identify studies with sound methodology. A meta-analysis will thoroughly examine a number of valid studies on a topic and mathematically combine the results using accepted statistical methodology to report the results as if it were one large study. Both types of resources contain studies or reviews that have been reviewed, appraised, and assessed for quality, and the results summarized according to the predetermined criteria of the review question. Evidence summaries have been vetted by experts and are updated regularly to include the newest evidence. Evidence guidelines, or clinical practice guidelines, are statements to assist clinicians in making decisions about appropriate health care for specific clinical circumstances. Both types of resources contain studies that have been reviewed, appraised, and assessed for quality. Randomized controlled trials, referred to as RCTs, are carefully planned experiments that introduce a treatment or exposure to study its effect on real patients. They include methodologies that reduce the potential for bias and that allow for comparison between intervention groups and control groups. RCTs can provide sound evidence of cause and effect. These types of studies have not been reviewed, appraised, and assessed for quality. You will need to appraise these resources. You'll learn how to do this in Part 3 of the tutorials. Background or foundational resources may vary from expert opinion to high levels of evidence. These resources include point-of-care resources and integrated clinical tools that can be used to answer questions while caring for the patient. These resources may or may not be evidence-based. You may need to appraise these resources. Now that you've been introduced to the evidence pyramid, we're going to take a step back and recall Sarah, the pregnant teenager you met during The Edge. Perhaps you recall that she had back pain at the time of your first meeting. She had attributed this back pain to her work in the community garden, but had since realized that it might be related to her pregnancy. You sent Sarah to a physical therapist, but was this referral based on the best medical evidence? Sarah and you both wanted to avoid using any drugs that might harm her baby, but perhaps physical therapy wasn't your only choice. Your next step will be to use the PICOTT tool, put your inquiry skills to use, and begin constructing a search in PubMed to locate research literature or treatment options that could be considered. In order to search PubMed, you'll need to frame a question from which you can draw the key components. You may have previously heard of a tool called PICO, used to help you frame the question before you conduct a search. Quite simply, this is an acronym where you identify the pieces of your question: patient or problem, intervention, comparison intervention, outcomes. We're going to use an expanded tool, PICOTT, with an additional 2 T's. These are added if they apply, and in this case, they do apply. The 2 T's stand for type of question and type of study. Let's just start with PICO. It's easy to think of this in a little chart that you will fill out. Next, we'll look at the type of question. Take a minute to examine this chart to determine which question type you'll use: diagnostic test, prognosis, therapy, etiology harm, prevention, or cost analysis. If you believe you'll be looking for a therapy question, that would be correct. And if you look to the right side of the chart, this indicates the study type, randomized controlled trials. You'll learn more about the different study types in the 3rd tutorial. Your next step would be to make your own chart in this format. When completed, your chart should look like this. Patient is pregnant teen suffering from low back pain. Intervention, physical therapy. Comparison, none. Outcome, relief from back pain. Type of question, therapy. Type of study, randomized controlled trials. From your PICOTT chart, you'll form your clinical question. In a pregnant patient with low back pain, what intervention will bring relief without harm to the mother and fetus? You've identified this as a therapy question, and you'll want to filter results to randomized controlled trials for evidence. This tutorial covered the 4 steps of evidence-based medicine, the 4 levels of evidence, the 3 types of resources, and how to form a well-written question using PICOTT. Based on your prior experience on Sarah's baby, the PICOTT tool that you filled out and the framing of the clinical question in the 2nd tutorial will be moving to Medline PubMed to conduct the actual search. But first, proceed to the question on Canvas for Part 1, Introduction to Evidence-Based Medicine.